I'm Mitchell Grayson. I'm an allergist here at Children's Hospital, Wisconsin. You know a little bit about what patients are going through. You have a little bit of idea of how the symptoms are, you can communicate better with the patient, understand what they're going through, at least in terms of seasonal allergies and things like that. I also know a little bit about how medicines work and don't work on me, so I have some way of having a relationship with the patient in terms of understanding how they may or may not work. It's the real world experience. So it's the ability to take what we learn in the lab and apply that to our patients, but also to see how the people with these diseases are responding to the various treatments, what it is like to be in real life. It's one thing to say we found a way to cure disease X, Y, or Z, but if it's a way that people can't actually take that medicine or can't do that, it's not going to have any way of improving their life or anything like that. So it's being able to sort of work with the patient, understand what they're going through, and then take that back to the lab as well and say, okay, is this something that's really relevant to human disease or not? There's what happens in the lab, and finding something cool and exciting in the lab is obviously one thing. As far as my clinical duties, it's being able to have a patient who's had, say, a lot of problems with, let's say, asthma, hasn't been able to get it under control, has had to miss school, lots of problems, comes to see us, and we're able to actually get them on medication that gets their asthma under control. Now they're back in school. Now they're playing basketball or they're playing soccer. They're able to keep up with everybody else. They're sleeping through the night. And being able to hear that they've actually had this great outcome is a wonderful thing.